Nerves. Published by WordPress.com. Radial nerve entrapment, radial tunnel syndrome and pin compression. Definition. Radial nerve entrapment refers to the compression of the radial nerve at various sites, including the posterior interosseous nerve, pin, and radial tunnel syndrome. This condition leads to pain, weakness, and sensory disturbances depending on the location and severity of compression. Epidemiology. Pin compression is often seen in manual laborers, bodybuilders, and individuals engaged in repetitive wrist and forearm activities. Radial tunnel syndrome and pin compression are common in people who perform tasks involving excessive supination or gripping. Anatomy. 1. Radial tunnel. Length, approximately 5 cm. Extends from the radiocapitellar joint to the edge of the supinator muscle. Boundaries. Lateral. Brachioradialis, ECRL, extensor carpi radialis longus, ECRB, extensor carpi radialis brevis. Medial. Biceps tendon, brachioradialis. Floor. Capsule of the radiocapitellar joint. 2. Posterior interosseous nerve, pin, compression. Compression occurs in the forearm due to fibrous bands or muscle structures, such as the arcade of Froese, which is the proximal edge of the supinator muscle. Other sites include the fibrous edge of the ECRB, the leash of Henry, recurrent radial vessels across pin, and the distal muscular edge of the supinator. Etiology. Radial tunnel syndrome and pin compression may result from elbow dislocation, radial head fractures, space-occupying lesions, compression from fibrous bands, such as the arcade of Froese, scissoring action of the brachioradialis and ECRL during forearm pronation. Clinical presentation, C.P. Pain. Pin compression. Pain is typically localized in the forearm and worsens with activities requiring supination or wrist extension. Radial tunnel syndrome. Pain is located along the dorsal lateral forearm, often worsening with activity and palpation. Paresthesia. Pin compression. May present with sensory changes in the dorsal aspect of the hand and the first web space. Radial tunnel syndrome. May involve the dorsum of the hand but without significant sensory loss. Weakness. Pin compression. There is no weakness in wrist and finger extension, ECRL, but grip weakness may be noted due to intrinsic muscle involvement. Radial tunnel syndrome. There is no weakness in wrist extension or radial deviation. Provocative tests. Pin compression. Resisted supination test, positive if pain is reproduced. Tinel's sign, positive over the radial nerve at the wrist. Radial tunnel syndrome. Resisted supination test, positive if pain is reproduced. Radial tunnel injection test. Pain relief with local anesthetic injection confirms the diagnosis. Tinel's sign, positive over the radial tunnel. Differential diagnosis, DD. Pin compression versus tennis elbow. Tennis elbow presents with tenderness at the lateral epicondyle and may be distinguished by a tenodesis test or passive wrist flexion. Pin compression does not present with tenderness at the lateral epicondyle. Pin compression versus extensor tendon rupture. Extensor tendon rupture can be differentiated using the tenodesis test and the absence of pain on passive wrist flexion. Treatment. Conservative. Splinting. Wrist extension splints with elbow flexion and supination to reduce compression at both sites. Physical therapy. To improve strength and flexibility of the affected muscles. Operative. Radial tunnel release. Surgery to release compression from fibrous bands or muscle structures at the radial tunnel. Decompression of pin. If non-surgical methods fail, surgical decompression at the sites of compression such as the arcade of Froese or fibrous edge of the ECRB. Complications. Pin compression and radial tunnel syndrome may lead to persistent pain or weakness if left untreated. In severe cases, long-term compression may lead to irreversible nerve damage. Additional notes. Radial nerve entrapment in the arm can occur in the spinal groove, via the fibrous arch, and may resolve spontaneously over several weeks after vigorous exercise.